I think we live in a culture that's really very good at hiding the fact that death exists. We don't talk about it. When you tell people you work in palliative care, the first thing that they say to you is, "Oh, that must be really sad." There is sadness inbuilt into the role, but I have been in people's houses with them and we have been laughing our heads off at something ridiculous.
Even nurses with more experience than me, they would be giving handover at the end of a shift and they'd say, "Mr. such and such is probably going to die. I hope he doesn't die on my shift." And I just thought to myself, I actually hope they die on my shift, because being able to support the family, it's such a privilege to be there and to do that for someone's mother, wife, father, son.
It's good care. I think palliative care encompasses what a lot of us move into healthcare for, to be able to help people and make sure they're comfy and live their best life.
Palliative care is different from other fields that I've worked in the sense that sometimes the focus might be on the family, the carer or the significant people in their life.
The patient called Bert, who had a very severe head and neck cancer, and his wish was to remain at home to die. As Bert's symptoms got worse, I said to him that I don't think I could keep you at home because this and this and this may happen, and I don't want you to die that way. He ended up disclosing to me that it actually wasn't his house that he wanted to die in, but it was his bed that he wanted to die in. So Bert was 80 years of age and he was actually sleeping in the bed in which he was born 80 years previously in that house. Our maintenance men at our hospital came to his house and disassembled his bed and took it up to the hospital, reassembled it, and we brought Bert up. And he died 4 days later in hospital, but in the bed in which he was born.
There's something special about palliative care that we can really make a profound, long-lasting impact for people.
Being able to connect and build rapport with our patients and families, I think, is any palliative care clinician's superpower.
You need to have the capacity to be empathic and feel with people and navigate some of that stuff, but you need to have some boundaries in place so you don't absorb all of that as well.
Don't feel that you can always fix things, because generally you can't.
Stop and take stock. So have a look at the whole situation. Don't join the party of people rushing in to help. That sometimes you need to step back and review the whole situation and then make a plan.
If a student was wanting to work in palliative care, the things that I'd advise them are to make sure they do a placement as much as possible.
Take the leap.
Go right ahead and make the decision that you feel is the right decision for you, and to follow your heart into palliative care.
Go for it. I don't think I would change my pathway.
It was and remains the best decision that I've ever made.